Hello, sir. I'm Claire. I'm with EMS.
Hi, Claire.
Can you tell me what's the problem today?
Tried to eat breakfast this morning. Threw up a whole bunch of blood.
Is there any medication, sir, we can look for?
The only thing I take is some ibuprofen for my arthritis.
Oh, okay.
Might need to lie down somewhere.
Okay, you know
His
what?
pulse is really thready. We should
Sure.
probably grab the stretcher. Yeah, we've got a pressure. It's 80 on 40.
Your blood pressure's a little low there. That's why
Really?
you're feeling kind of crappy.
Okay.
Go ahead and relax, sir. Just lay back.
All right.
You know what? I think we'll do a quick IV before
Uh-huh.
we get going here, and then we'll get you off to the hospital.
Kind of knew something was wrong yesterday when I was having some bowel movements and they were black.
You're bleeding into your
Really?
GI tract. Yeah, that's what that means. Yeah, you're ready to go.
Okay.
This is 70-year-old Gordon Jenkins, who's suffering from an upper GI bleed. He's had abdominal pain for the last 3 days, and he's been vomiting frank red blood today. So his vitals are, BP was 80 on 50, heart rate 120, SpO2 is 93%, RESPs are 18, temperature is 36.5. We've given him 4 milligrams of ondansetron and 1 liter of normal saline. Any
Did
questions?
his blood pressure change post?
No,
No.
that was the initial blood pressure, and it
Okay.
hasn't changed after the fluids.
Hello, sir. My name's
Trina, can you
John.
get the oxygen transfer for us? We're just gonna get you over onto our monitor. Oh, we'll get you sitting up here. We'll get you changed.
Just put this down, sir. Yeah.
Are you still feeling like throwing up?
No, a little bit, yeah.
We'll try and get you some medication for that in a moment. Thanks.
There you go. So, sir, this is like at the dentist. If you're gonna be sick.
Okay.
Okay.
Just gonna have a quick listen to your belly here, okay?
I'll sit you back up here in a second.
Thank you.
37-0. Thank you, Johnny.
Okay, is it worse in any one place than another?
Sort of further up there, right? It's sort of the middle. Yeah. Yeah, that's probably where it's the worst.
Right about here?
Yeah.
Okay. Abdo soft, bowel sounds ×4. And he's tender over his epigastrum with light palpation. When was your last bowel movement?
Yesterday.
And was it normal?
No. Black and kind of stuff.
Okay. I'll start another 18 AC on the left here.
Okay.
We'll do CBC lights, type and screen, and a PTINR.
Sounds good. I'll write that.
Awesome. So I was thinking we could do a VBG and then we'll get an early hemoglobin.
Okay.
And I think he's first to be seen right now.
Okay, so we got a 70-year-old man with upper GI bleed on NSAIDs. He hasn't responded to 2 liters of normal saline. We're gonna give him blood. We'll reassess him after those 2 units of blood. He's pretty sore in his belly. We'll do the 3 views of his abdomen. I'll talk to GI. How does that sound?
Good. Did you want us to follow with the Panto continuous infusion after that bolus?
Yeah, I think we can start that as well. Okay?
Sounds good.
Thanks.
Hi, Gordon. My name's Morgan. I'm gonna do your x-rays today. So you've been having some abdomen problems, hey?
Yeah, this morning. Oh,
Okay. Do you feel like you can stand up for these pictures though?
I think I can.
Okay. So this board's just gonna slide down behind you. Are you doing okay still?
Yeah.
Okay, so right now, breath in and blow it out. And you can breathe normally. Okay, so right now take a breath in and blow it all the way out. And you can breathe. So that's everything, Gordon.
Hi, my name's Diana. I'm going to be your nurse today.
Hi,
How
I'm
are
Gordon.
you?
Gordon
Hi,
Jenkins.
Gordon. Nice
Yeah.
to meet you.
Nice
Gordon,
to
I'm
meet
just going to take your blood pressure and get your oxygen saturation and tell you a little bit about the procedure.
Sure.
When was the last time you had any solid food?
It was yesterday morning.
Okay, so we give fentanyl and midazolam usually as sedation. Do you have any allergies to any of those?
I haven't been made aware of any.
Okay, fantastic. Have you ever had sedation before?
No, I have not.
Okay, perfect. So the sedation will make you just a little bit drowsy, a little bit lightheaded perhaps. Do you have any questions about anything?
No, I don't think so.
Okay.
Hi, Diana. Can we have 50 mics of fentanyl and 3 milligrams of midazolam, please?
Sure. 50 mics of fentanyl, 3 of midaz.
Yes, please.
Okay. Just gonna flush your ID first.
Sure.
This is fentanyl. Medaz. Fentanyl, Medaz given.
Thank you.
Hi there, Mr. Jenkins.
That's right.
Hi,
Yeah.
My name is Shay. I'm one of the respiratory therapists.
And Shay. Yeah.
So to start off, we just have some monitors to put on.
Okay.
So before we get you off to sleep, we're just going to get you breathing some oxygen.
Okay.
So I'm just going to hold this mask here for you.
All right.
Pass it to Tim. And you have a grade 4 view here.
Grade
Dr.
4 view?
Dwight. Yeah, I can't really see anything.
Yeah, that's a really difficult airway. Can we get the difficult airway cart brought in the room immediately? I'm just
grab
going to
that.
beg for a minute just while we're waiting for that. Thank you. At the moment I can ventilate okay, so Shay, I'll get you to give 100 milligrams of propofol
Okay.
as soon as possible. Thank you.
All right, so I'm giving 100 milligrams of propofol right now. Right. 100 milligrams of propofol have been given.
That's pretty good there, Shay. Please advance the endotracheal tube.
Yep.
All right, looks like we're in a good position, so that's great. Thank you.
Hi, Gordon. My name is Tina. I'm one of the speech pathologists in the hospital.
Hi, Tina.
Hi. They've called me in today to check on your swallowing.
Yeah.
And so, can you tell me what's happening?
I can't seem to swallow things properly. You know, coughing and stuff.
Okay.
Yeah.
Okay. What are you coughing with? Everything or
Mostly liquids,
liquid?
but not food.
So, Gordon, I'm just gonna get you to take a sip of this water here, and I'm gonna put my fingers on your throat and feel you swallow. Okay?
All right.
Okay. Are you okay?
Yeah.
So is that what's happening every time you swallow?
Every time.
Okay. So next I'm going to try you with a little bit of a thicker liquid. It's a nectar thick cranberry juice.
All right.
Is that okay?
Yeah,
And
yeah.
let's see if that's any easier.
Great. That's not bad.
It looks like you're just having a little trouble with the water right now, so I'm going to switch you over to our nectar thick fluids for a little bit. But you can keep eating regular solids, okay?
And this thing with the water is go on for a while.
No, it should go away. I think it's just because you were recently intubated, which is why your voice is probably a bit hoarse.
Okay.
So we'll keep an eye on both of those things.
Hi.
Hello, Mr. Jenkins.
That's right.
My
Hi.
name's Claire. I'm one of the physiotherapists here at the hospital.
Hi, Claire.
And Mr. Jenkins, I'm Beth. I'm the occupational therapist.
Oh, I see so many people here. I mean, what exactly do you do?
So we're part of the rehab team, and it's our role to help make sure people are ready to go home and function well and safely at home as quickly as possible. So from a physiotherapy perspective, I work on how well you get in and out of bed, you're walking, thinking about activities at home.
Okay.
And then the OT role is basically we look at everyday functions. So again, how do you dress yourself? Are you able to get up and go to the washroom? Grooming, personal care, everyday activities you'd be expected to do at home. So everything from cooking, laundry, cleaning.
So we have a few questions for you about your house setup so that we know what we're working towards and what things we need to strategize.
Sure.
So do you live by yourself?
I do.
Okay, and what kind of house do you have? Is it a
It's
condo
it's
or
a two-story affair.
Okay. Do you have stairs to get into the house?
Oh yeah.
Does it have a railing on those outside stairs?
Never been necessary.
And the bathroom upstairs, Mr. Jenkins, is that a walk-in shower, a tub shower combo?
No, it's a tub shower combo.
Okay.
Yeah.
And is there any equipment like bars along the wall to help you on and off
Never
the toilet
needed it
in and out of the
before.
shower? Okay.
And I will teach you a way to get in and out of bed that doesn't pull on your tummy muscles as much.
Okay.
There you go. How did that feel?
Not bad.
All right, well, I think you did pretty well.
Thank you.
So I think the next step is to get you up walking, and if you do well, we'll take you down to the gym and look at things like stairs.
Oh,
and
gym. Excellent.
No marathons today. And the railing is going to be on the left side in your house, so we'll make it like your house.
Okay.
So you leave the cane down,
Yeah.
and you're going to try and step up and push.
Okay.
All right.
Good job.
Yeah.
There you go. So pretty tough.
Yeah,
We need a little bit more time practicing before you're ready to go home.
All right.
Okay?
So I have a fun pair of hospital pants here.
Oh, they look stylish.
Perhaps we'll put those on first. So I'm just gonna see how things go. So we have this thing called a long handle reacher. Basically it acts as almost an extended arm. And so it does help to just give that a little bit more length so that you can reach down to get those pants on.
That's not bad. Need to practice a bit more though.
Yeah, no, it definitely does take some practice. Okay, so Mr. Jenkins, this is our ADL bathroom suite.
Okay.
So basically the reason we're coming here is just to simulate what it might be like when you get home and if there's any challenges or if there's any equipment needs you may have. So we have something I want to show you.
Okay.
There's a raised toilet seat and basically it secures onto the toilet to give a little bit more height. So sometimes what we recommend, there's this stool or there's bath seats, there's different variations, but basically it just goes into the tub.
Okay.
This might be a piece of equipment that we'd also recommend upon your discharge, and again, we can get that through any of the medical vendors here in the city or through the Red Cross
The
program.
Red Cross, yeah.
Mr. Jenkins?
Gordon, please. My
Oh,
dad
of
was
course.
Mr. Jenkins.
I'm Chris. I'm the social worker on the unit.
Are you? Okay.
Yeah, I'm part of the interdisciplinary team.
Okay.
And my role is to do a brief assessment to ensure that your needs are being met here in the hospital.
Great.
And that we can set you up with the appropriate resources for when you go back home.
Okay, fantastic.
First off, I just noticed on your chart that you don't have a key contact listed.
Is that a problem?
Well, we like to have a key contact if ever we need to contact someone if there was an emergency.
Okay. Well, my wife Debbie would have been my key contact, but she passed away 2 years ago from a
Oh,
heart
I'm
attack.
so sorry.
Yeah.
How long were you married for?
43 years.
Do you have any children?
I have a son, George.
Would you like him to be your contact?
Not particularly.
Oh.
He and I have some issues.
Okay. Is
Last time I saw him was at Debbie's funeral.
Oh, so he doesn't even know you've been hospitalized?
No, he doesn't.
Okay. Would you like any assistance? Would you like to contact him, or would you like us to contact him and let him know that you're here in the hospital?
Not quite ready for that right now.
Oh.
Given some time, we might be able to, connect, but I'd rather you didn't.
Okay. Through AHS, we have a grief and loss program, and I was wondering if you wanted the phone number for that. You can contact them on your own time.
I'd like that, actually.
Okay.
That'd be good.
Do you drink or smoke?
I don't smoke, but
Good.
I really like my beer. Yeah.
Sometimes as we age, substances affect us differently than they did when we were younger.
Yeah.
We do have a program through AHS called SAIL, S-A-I-L-L. It's an outpatient program where people just go and talk about their substance use.
Right.
I don't think that's an issue for you.
Thank you.
But it is something that we like to highlight. Thank you so much for your time today.
Really pleasant. Thank you very
Thank
much.
you.
Chris.
Is there any reason that we can't discharge Mr. Jenkins?
From a speech perspective, we have him back on regular fluids and regular solids, and his voice is back to normal again, so he's good from us.
And from an OT perspective, Mr. Jenkins is independent with his ADLs, given that he has been provided with some equipment. He probably would benefit from an OT-PT home care referral just for permanent equipment needs, and then perhaps transition services could follow up with him.
I've given him the contact information for the grief and loss program. He can follow up once he goes home, so he's cleared from social work as well.
So from a physio perspective, he's still struggling with stairs and he has a full flight at home. So I'd like a couple more days to work on his strength and endurance before we let him go. So maybe just 2 or 3 more days.
Hi, Gordon.
That's right.
Hi, Gordon. My name's Lindsay. I'm one of the dietitians on the unit.
Hi, Lindsay.
So I'm here to just chat with you briefly about your nutrition and how you've been eating. Does that sound okay?
Sure.
Okay. So as far as the next step goes in getting you home and getting you healthy, one of the concerns would be your weight loss. And the main concern around that is that it happened quite fast. So when we lose weight really fast, it tends to come from our muscle stores and not the fat stores like we wish it would. So we just want to make sure that we maximize the nutrition that's in that food. So giving you lots of protein and some vegetables, if that's okay. Maybe not broccoli, you can pick the ones that you like. So we'll monitor you while you're in hospital. We might do some calorie counts as well. Would you be open to trying some nutrition supplements while you're here, some of the Inchers or the Boosts that we have available?
Sure.
Okay, so I'll order you a few of those and we can pick out the flavors that you like. I'm also going to put you on a multivitamin that we have on the formulary just to, again, supplement your needs right now because your requirements are a little bit higher for healing.
All right.
Okay, well, it's a pleasure meeting you.
Pleasure meeting you.
And we'll
Lindsay.
chat again.
All right.
Okay.
Thank you.
Gordon, hi, my name's Ginny. I'm one of the pharmacists here on the unit.
Jenny.
How are you?
Excellent. Very
Getting
good.
ready to go home, I understand.
Oh, yeah.
Got your prescriptions here that you'll need to get filled at your community pharmacy when you're heading home, and I've got a list of your medications. So the first one I've got here is a medication called pantoprazole. It's what we call a proton pump inhibitor, and it works to turn off the stomach acid in your body. So it's really easy to take. It's 1 tablet twice a day, at least until you see your family physician again. Most people need it at least twice a day for 8 weeks or 2 months. The next two here I'm going to talk about together just because they're both antibiotics. Apparently when they did the biopsy of your stomach, they found a particular type of bacteria growing, and we call it Helicobacter pylori. It's very common, but it does put people at increased risk of having that ulcer in the stomach. The other one here is called metronidazole, which is the other type of antibiotic we use in combination. The other thing that's really important with this one is to avoid alcohol. It does make the abdominal pain quite severe and a lot of nausea and discomfort. So if you can, please try to avoid having any alcohol while
So
you're
after I
taking
finish
one.
this, I might have a beer or two, or is this,
Yes, after you're finished.
after I'm finished?
Usually I understand you have some arthritis pain in your knee or
I do.
your shoulder.
And generally, I tend to use ibuprofen for that.
Unfortunately, medications like ibuprofen, we also call them anti-inflammatories, they can be quite hard on the stomach. And it's possible that your ibuprofen actually contributed to it in any way.
Really?
You can look at something like this. It's called a dosette box.
It's not snappy.
It is. It's not too big and cumbersome, but it has the days of the week along the top and the times of the day.
Okay.
And then you just fill it up once in the week and forget about it. And then every day you can kind of look at it to see if you remember to take what you were supposed to take that day. Great. Well, I hope you do well, Mr. Jenkins.
Well, thank you very much.
Very nice to
Jenny,
meet you.
Nice meeting you too. All right.
Take care.
I will. Thanks.